In 2001, African leaders at an African Union meeting in Abuja pledged to allocate at least 15% of their annual budget to the health sector. About 17 years after, Nigeria is yet to live up to her part of the agreement, as the health sector has been plagued with inadequate financing. In 2018, for example, a total of 340.45 billion naira was voted for education out of the 8.62 trillion naira budget. This represents a meager 3.9% of the total budget and is lower than the 4.1% allocated in 2017. In fact, the highest percentage allocated since the declaration is 5.95% in 2012. And for a country where citizens spend an average of $1 billion annually on medical tourism, this is worrisome, especially as the World Health Organization puts Nigeria's healthcare system at 187 out of 190 countries, and the country with the third highest infant mortality rate in the world. Considering the fact that the Abuja Declaration was made in Nigeria, one would expect that Nigeria would take the lead in financing, but that is yet to be, as even poorer African nations have budgeted a higher percentage of their money to the health sector.
Before 1985, it was the government hospitals that were servicing this nation. And these government hospitals, run by government people, run by hospital administrators, were the hospitals that put Nigeria on the world map, where some of our hospitals were rated as the 5th best hospitals in the Commonwealth.
Nigeria has also had to battle outbreaks of Lassa fever, meningitis, measles, and more recently, yellow fever, with support for vaccination coming from international donor agencies. These aside, the primary healthcare system is not as functional as it should be, as many primary healthcare centers are in a dilapidated state and therefore cannot cater to the people, particularly those in rural areas. This has resulted in other challenges, as the Federal Ministry of Health reports that only 40% of pregnant women go for antenatal care. And for progress to be made, more funds have to be allocated to the health sector. These funds also have to be released in time and utilized properly. Also, the coverage of the National Health Insurance Scheme (NHIS) has to be widened so as to reduce out-of-pocket payments for healthcare services. Okemute Imonirwa, STV News, Abuja.